Hello, I'm Val Gleason, the President and CEO of Newton Medical Center. Today we're still in the middle of flu and cold season, but we've had something new added to our equation this year in the form of a novel virus that we refer to as coronavirus or COVID-19. I want to thank you for joining me today as we talk about COVID-19. And I want you to excuse me too. From time to time I'm going to review my notes so that I don't forget to tell you something that I think is important to say. It's been stressful. There's no doubt about that. In working with our staff, though, at the hospital, we realize one of the most important things that we can do is to deal directly with the facts. So we've been going straight to the facts of the disease that have been provided to us by Harvey County Health Department, the Kansas Department of Health and Environment, and the Centers for Disease Control and Prevention, along with the experts at the World Health Organization. We also depend upon the local experts that we have in our vicinity in Harvey County and beyond, but specifically our Newton Medical Center physicians, pharmacists, nursing staff, therapists, and so many others who are following the course of this disease as it rapidly expands throughout the world. COVID-19 has quickly changed our landscape since it was first detected in China just a few short months ago. It's a new virus that's never been before seen in humans. When new viruses emerge in humans, in other words, never before seen, we refer to them as novel. And they're important to us in healthcare because typically humans have no immune response to novel illnesses. COVID-19 is so new that we don't have a vaccine for it either. And there may not be a vaccine for another year to 2 years. This virus seems more potent as well. COVID-19 does seem to have a higher mortality rate than influenza, and this increased risk is what has us concerned. So all around the world, including in Newton and Harvey County, we are working to limit the exposure to the virus so that we limit the numbers of people who come down with the disease. I want to reassure you that Newton Medical Center, through our hospital and all of our clinics, remains committed to the vitality and the health care of our community. We launched an incident command post internally at the hospital on February 3rd. And that was in response to what we were seeing in China with the outbreak of the COVID-19 virus and how the Chinese were coping with it. We've continued to work diligently since that time with officials throughout the hospital and locally with Harvey County and statewide with the Kansas Department of Health and Environment. We're working closely with our community partners today through Harvey County Emergency Response and the Harvey County Health Department. First and foremost, I would like to thank you. Thank you for joining me today, and thank you for standing by with us as we make some very tough decisions. Those decisions are being made around the world, but they're being made right here at Newton Medical Center as well. I ask you to respect the decisions that we're making about how the hospital operates. And we're asking you to respect the decisions of the local, state, and federal authorities as they do everything in their power to limit this disease. I'd like to thank you for listening also to the advice of your clinic physicians, your physician assistants, and your nurse practitioners, because sometimes the path isn't very clear. We're all using the same emerging information to guide our best actions. I ask you to be mindful of our healthcare workers, of all of our public health officials, and first responders locally and around the world. These folks are working hard for you and those you love. Thank you for taking to heart the precautions set forth also by the Centers for Disease Control and the World Health Organization. By observing these precautions, you're protecting yourselves and your loved ones, and importantly, healthcare workers, who we need to be very healthy right now. Some of the precautions you should be taking at home include social distancing. That means staying 6 feet away from other people when you are out in public. You should also be practicing good hand hygiene. Soap and water is just fine. Alcohol-based solutions containing 70% alcohol are prescribed in our hand sanitizing solutions that can be bought commercially. Covering your coughs and sneezes and disposing of tissues and then washing your hands is important. And as I just did, I touched my face. Don't you do that. Keep your hands away from your eyes and nose and mouth, and when you touch your face, please go wash your hands, which I will do immediately after this. You should also clean and disinfect surfaces that are commonly touched, such as doorknobs, keyboards, telephones. We would ask you to abide by the hospital visitor restrictions. Those restrictions are already in place, but I believe that as the days progress, they may be tightened up. So please stay tuned with us at the hospital to find out who is authorized to visit patients. We'd ask you also to abide by quarantine guidelines should you be exposed to the virus. As we learn new information, we'll continue to update our response to this virus. We will post updates via our website at newtonmed.com/coronavirus, as well as Facebook, Twitter, and other social media channels. In closing, I'd like to say, although we may not be together because of social distancing, we are all in this together. Now is the time to support one another. Check on your neighbors. Check on the elders who live around you. Your actions today may impact others tomorrow. Most importantly, stay calm, plan, and get to the facts. Although we don't have anyone in Harvey County today who's come down with COVID-19, I ask you to be mindful of those who are infected and for their dear families. I also ask that you keep our nation's healthcare workers, business owners, displaced workers, senior citizens, caregivers, and stressed out young parents in your thoughts and prayers. I especially ask that you pray for our nation's leaders at this time. Thank you for joining me today.